Dr. Nurena, hi.
Hey, how are you?
I'm fine. We meet again.
Yes.
Yes. Um, Prior to our chat talk on behavior in the medical setting, I wanted to talk a little bit about the behavior of cats as opposed to dogs, which really affects the medical setting or their behavior within the medical setting. And it's interesting because we always had a saying called cats are not small dogs when we went through veterinary medicine, but we never talked about how to handle them differently, how to change the environment, or what really makes them not small dogs. So I'm going to talk about that a little bit.
Do you really have that expression?
Yeah,
Pediatricians love to say that kids are not little adults.
there you go.
So,
So cats' preferred strategy is avoidance. They're solitary, and compared to the socially obligate nature of dogs, this means cats do not depend on social contact to survive. They do just fine by themselves, no matter how much you think a bunch of cats love each other and snuggle and lay on each other. If you took 4 of the 5 cats away, the 5th cat would be just fine. They also like their environment to remain stable. So if they're in the hospital and they're crated and the litter box and food and water bowls have to be removed to be cleaned, for instance, you want to make sure to replace them exactly where they were before, or it becomes a stressor for the cat. You do not redecorate cat homes. Cats don't do well with change, whereas dogs adapt relatively easily as a species. Cats really have to feel that they're able to escape from or avoid potential threats. They don't like to be cornered, in other words. They like to feel as if they're in control. Because we as humans rarely provide everything that I just said at home or within the cat's home or the human's home, then it is definitely even more difficult to provide it in the medical environment. Cats, therefore, throughout their lives are often in chronic low-grade stress, and we don't realize it. We think they're purring, they're just doing fine. There's an immediate mismatch between what we require to provide medical evaluation for a cat and to help them medically, and what the cat requires in order to be comfortable and in their minds to even survive. When you think about dogs, you think that actually that they have many social signals with their eyes, their ears, their entire body, their tails, and they have a broad range of appeasement behaviors. Cats do not. Because of their preference for being alone, they lack the same ability to gather information and react accordingly. So their repertoire is limited, and consequently, they're often unable to resolve conflicts or to stop it before it starts. They don't have a way of being submissive to laying their ears back in a more gentle way. Their ears go back, there's a big problem. So cats are also essential hunters, but they have an extremely low success rate, less than 10%, it's estimated. So they're nothing if not patient and persistent. But if they're unable to hunt, then they will still respond with predatory behavior. And unlike dogs, signs of dominance and submission are almost absent in cats and are basically irrelevant to their social situation. So with cats, the last resort is physical confrontation. That's why you see a cat go from 0 to 60 without giving any sign that they're going to erupt in the same way that dogs do. If they give a sign, it is a very brief one, and you have very little chance to get out of the way. Cats need control of their environment. So we give a concrete example of everything that I just said in our talk.
really interesting.
Yeah. Yeah.
And they're not little adults or little dogs.
That is so true. And we can think of cats as being chronically stressed. Does that equal chronically traumatized? Not necessarily.
That's encouraging.
Yeah. So when we talk about trauma-informed care in our talk, we'll be fleshing that out a little bit.
I always learn interesting things when we chat.
Yeah, so do I. It's wonderful.
Yeah, thanks.
Thank you. Have a good evening.
You too.